I'm Dr. Rajiv. I am practicing here in Dhanbad. Also, I have practiced in Ranchi and Hazaribagh. In my opinion, the drug which are used to decrease HbA1c level in diabetes patients are most of them. The most, as per books, if you'll say, the most important drug is insulin. It decreases by 1.9%, and then there is new drugs like semaglutide 1.7%. Then comes the drug I want to say metformin and glimipride combination sulfonylurea. There are 1.5%, 1.2 to 1.5%. Alone also it decreases by 1.1% metformin and 1.4% sulfonylurea like glimipride. But in combination, they have a better efficacy. It decreases by 1.5%. Also, some SGLT2 inhibitors like empagliflozin, dapagliflozin decreases by 1.4%, and the DPP4 inhibitors also decreases by 0.8%, 0.7%. But the thing I have to admit that in my clinical practice, I have used metformin with glimipride much more than any other drugs. Like insulin, it is an injectable drug. My patient don't want to take insulin, first of all. It has a risk of even developing hypoglycemia at a longer race. The newer sulfonylureas like glimipride and gliclazide are even having the less chance to develop hypoglycemia. But we have to use these drugs for a longer period of time. In SGLT2 inhibitors like dapagliflozin, I have to stop in many patients because of having this UTI and lower fungal genital fungal infections. So my patient have to drop after 3 to 4 months. Many a times, I'm not saying they are not good drugs, but for long-term use, I believe still, in my opinion, that metformin and glimipride. As such, if you compare both the drugs, metformin increases the insulin sensitivity, whereas the glimipride increases the insulin secretion. So in short race, this glimipride will work better, and in long race, it will increase the metformin will increase the insulin sensitivity, and it will increase insulin sensitivity, and it will help in decreasing the HbA1c levels. So in combination, both they actually overcome the side effects of both of the metformin and glimiprides, and after that we will say here other drugs have more side effects than them. As per in clinical practice also, the semaglutide which has come in the market right now, it is very price effective, but on the long term patient will develop this nausea vomiting tendency, and they actually gain weight a lot after they stop the drug. So overall compliance for the patient, I see it is much better than for metformin and glimipride than any other drugs. So in my opinion, again, for long-term compliance and long-term efficacy, I trust and I believe, because metformin and glimipride combination are one of the best combinations. I'll use it for today also, and in I think near 10 years in future also. And the cost is also good. The cost is well under control. The patient can afford it, and overall we can add diet and supplement exercise also for better control for HbA1c. Also, HbA1c we see every 3 months. So in 3 months, an RBC cycle completes 120 days. So again, it is not a 1 day or 2 day or 1 month or 2 months. It is 3 months. It is more than 3 months, 1 year. So I believe we have to understand that the combination of these two drugs can be taken for longer period of time. Still, in my opinion, metformin is one of the best drug in market and is the first choice of drug whenever there is a case of type 2 diabetes mellitus. So let's focus on glimipride and metformin for a longer term goals, for the benefit of the patient, both cost economical as well as the lesser side effect. And I believe, as per as HbA1c concerned, my clinical experience, I have decreased seen patients of 11.2, 10.5. Recently, two patients came and sir, in 3 months duration, we have actually reached our goal to around 5 to 7. So I believe still they are the best drugs and it should be used. Thank you.